Hundreds of nurses at Robert Wood Johnson University Hospital in New Jersey are officially on strike, fighting for better staffing and for better pay.
Nurses say that they want better staffing levels so that they are not taking care of too many patients at any one time. They also want pay raises and a freeze on insurance premiums.
We just want safe staffing. We want to put into our contract so that every day we go in there, we know our staffing is safe.
12, 14-hour shifts have turned into 16-hour days, barely any rest break. I'm lucky if I could go to the bathroom.
We're finding nurses going on strike in Vermont and throughout this country for the same reason, to protect their patients.
Nurses are the infrastructure of our entire healthcare system. We're not going to have anywhere near the quality healthcare that we want, the kind of patient care we need, unless we have enough nurses to address our needs.
The level of frustration is unreal.
We were the ones here during COVID. We were the ones that never backed away. We did it without a vaccine, without masks. They weren't prepared for us, and no one complained. And now we're still being treated like we don't matter.
Nurses are overworked. The staffing patterns are enormously stressful. People are working just crazy hours, and they are unhappy about it because these nurses feel that they cannot provide the quality of service they were trained to do and that they want to do.
You know that in order for you to do your jobs in the way you were trained and want to do your jobs, we need radical transformation of the American healthcare system.
Good evening, everybody, and thanks so much for joining us tonight for what will be, I think, a very important and informative live stream. I don't have to tell anybody out there that we have a broken healthcare system. Healthcare is enormously expensive in America. We've got 85 million people who are uninsured or underinsured. We don't have enough doctors. We don't have enough nurses. We don't have enough dentists. We don't have enough mental health practitioners. We don't have enough pharmacists. We got a system that is broken in many respects. And tonight, we're going to talk about one aspect of a broken system that doesn't get anywhere near the attention that it deserves. And I got to start off by making a full confession, and that is, I love nurses. And I am a strong believer that the nurses in our country are incredible heroines and heroes. They are the backbone of our healthcare system. Doctors obviously do enormously important work, but if you're in a hospital, if you're in a doctor's office, most of the hands-on contact, most of the contact you're going to have with a medical person is with a nurse. And I think we all owe nurses an incredible debt of gratitude for what they did with COVID. Many of these nurses continued on the job without anywhere near the personal protection equipment that they needed. Many, many hundreds of nurses died, essentially putting their lives on the line for us. Others became seriously ill. And right now, what I want everybody to know is there is a very important and consequential strike taking place in New Brunswick, New Jersey. And that strike is with a United Steelworkers Local, Nurses Local. And what they are doing is not only fighting for better wages and better health care for themselves, that they are, but their major demand is for better nurse-patient ratios. This is an issue that we don't hear a whole lot about. And that means when you go to a hospital, you cannot, as a patient, get the quality care you need if nurses are overburdened. They're running all over the place trying to do more than a human being can do. And all over this country, what we have seen is nurses getting burnt out, exasperated, because they were trained, and what they want to do is provide quality care for their patients. But in many respects, they are just not able to do that because they're asked to do more than they can. And as we see the corporatization of medicine in America, these big, huge hospitals, look at the bottom line. What they're doing is squeezing their staff, especially the nursing staff, and demanding that their nurses do more than they should be doing. And the result is that patient outcomes are suffering. And what study after study shows, and we'll be discussing that tonight, is that if nurses do not have decent patient nurse ratios, the quality of care in hospitals deteriorate, people unnecessarily die or become sicker than they should be. So tonight we are really privileged to speak to some really wonderful and brave people. And these are two nurses at the Robert Woods Johnson Hospital in New Brunswick, New Jersey, and two other nurses who are members of the National Nurses Union. And the reason we've asked them to come on is these nurses have struggled to fight and won good nurse-patient ratios. And I want them to talk about the contrast between what existed before and what exists now. We're also tonight very fortunate to have my good friend, Senator Cory Booker from New Jersey. And Cory has been outspoken on this strike, defending the nurses. And we're just delighted to have him with us tonight. So I want to begin with Senator Cory Booker saying a few words about his assessment of the situation and why he's standing with the nurses in New Jersey. Cory?
Bernie, thank you so much. First of all, you have been a leader in the Senate on healthcare in so many fronts. And I've had the privilege of working with you on Medicare for All, working with you on safe. In fact, we wrote a great bill on safe, affordable importation of drugs from other countries to undercut the pharma industry here. There's just a lot of powerful things that you've stood up for. But when you are standing up and having New Jerseyans on, I cannot tell you how much that makes me happy. And just to Bernie's credit, like this is the kind of stuff that he focuses on day in, day out. And then when he told me he was doing this, I wanted to make sure I was on. Bernie said it. We have these extraordinary, heroic figures in our medical profession who are nurses. And a lot of lip service is paid to how amazing they are. A lot of folks don't realize how amazing they are until they're in a situation where they need medical care. But during the pandemic, I saw people laud them for their heroism. But yet we did not do what we should be doing in standing up with them to make sure that they are getting the pay they deserve, healthcare benefits they deserve, and issues like the staffing ratios are really critical. So many of our nurses who went through COVID dealt with trauma, stress, strain, and the challenges within their jobs. And this is a moment in New Jersey that is a significant moment for our state, but also for the nation. As Judy, I know, will tell you later, this has implications for the whole country. This is not just a local strike. These nurses are standing up, yes, for themselves, but they're also standing up for their patients, and they're standing up for their profession. And so I'm very grateful. There are 1,700 nurses in New Jersey who are standing strong. I'm proud. Senator Menendez and I have come out in support of them. Tomorrow, as I'm sure they'll tell you, they're entering some negotiations. And so I'm just wishing them all the blessings that they are able to stand up again, not just for their interests, but for the larger challenges we see in this profession. And I'll end with this, Bernie. I'll end with this. Our healthcare system is in crisis. It really is. It's as much as progress as we've made, and Bernie, I'm proud to have stood with you to lead a lot of that progress, expanding the Affordable Care Act in the last Congress, getting resources, doing things that have helped a lot of families. We still have people in this country that are really facing challenges, still going bankrupt, still seeing outrageous medical costs. But the workers who are medical professionals are also being squeezed in a system that is, to me, very unfair and very unjust. And we have got to make a change. So this strike in New Jersey, I hope people will continue to watch it. And I want to thank the leaders that are on tonight and all of those people who are out there on the picket line fighting for justice for New Jersey, justice for the profession, and really justice for the healthcare system itself.
Well, Cory, thanks very much. And I know the nurses in New Jersey are proud to have you on their side. And let's continue working together on this issue. And you're quite right. What the nurses at Robert Woods Johnson University Hospital are standing for is, in fact, a national issue. It impacts all of us. So, Cory, thanks very much. And I look forward to continue working with you. We have four great nurses with us, and we're going to begin with two nurses who, in fact, are at the Robert Woods Johnson University Hospital in New Brunswick. And we're going to begin with Judy Donnell. Judy is a registered nurse who has worked for 28 years on the same floor at Robert Wood Johnson University Hospital in New Brunswick, and she is the president of her union, United Steelworkers Local 4200, who represent the nurses at the hospital. Judy, thank you very much for being with us tonight. And if you could please explain to our viewers what are the conditions that have led you guys to take the very, very extraordinary act of going out on strike, and what are you fighting for your patients?
Okay, Bernie, if I may call you Bernie. I believe we're going into day 41 of our strike. In a country, in a nation, as you said, it's a national crisis. 41 days for nurses to be on strike, it's pretty much criminal. I don't understand why we haven't sat down, negotiated, gotten us back. I think New Jersey is one of the top 3 in the nation that leads the nation in nursing shortages. And here we sit for 41 days, and although we negotiate tomorrow, you probably, even if we came to a contract tomorrow, which I'm not sure that we will, we have to remain hopeful. But even if we did, you're looking at us still probably being out another week. So I don't see this strike ending before, say, 50 days or something like that by the time we get everybody back to work. But that aside, it is for the profession. The new nurses, I've spent 28 years on the same floor. I've been a nurse 30 years. The new nurses that are coming into the profession, it's a whole different ballgame for them. I mean, we have computers, we have labs, we have to draw, we do tech work. The nurse does everything. When you come into this world, the first one that brings you into this world beside the doctor delivers you, he leaves, she leaves. The nurse is the next one that takes you over. At the very end, when it's time to leave this world, many times a nurse is at the bedside. A nurse is there to hold your hand. And that's something now that it's limiting us to do. I work on a floor that's a stroke floor. I want to be able to sit there and tell those patients, this is why you possibly could have had a stroke. This is why I can give you what education I can give you. But having too many patients is limiting me from helping the patient along the way. The education part is suffering. And the new nurses who were through COVID, who didn't have the experience of clinicals, they're coming in really fresh, really green, I should say, and they don't have the wherewithal to say, I can handle 6 and 7 patients. It's overwhelming for them. That's why they're leaving the profession. I believe if we solve the problem of staffing now, we would be able to retain more nurses in our profession. It would be a better profession to go into. We were told, we went through COVID. Yes, we did all of that. We were a COVID hospital. People burying 7 and 8 patients, wrapping them a day. Nobody knows what a nurse went through. My first patient was 21 years old. He couldn't see his mother. I had to be his mother at that bedside. I had to help him with everything. I had to do all of that and take care of my other patients. It is overwhelming, even for a seasoned nurse. And I think safe staffing and staffing ratios will only provide better relief for the patients, bring more nurses into the profession, and the outcomes will become better. We'll have less infections. We'll have less readmissions. We'll have less CLEPSIs, CAUTIs. You'll have more time to explain things to your patients. And that's all we're asking for, is instead of giving the $35 million that they've spent so far on travelers, we haven't even asked for $35 million. We don't want that. It's not about money. It's about patient safety. And that's all we're asking for in this contract, is to get something that says, put it in the contract so we have something that's enforceable. That's where we are. The hospital came and met us part of the way with their guidelines or staffing. They didn't call them ratios. They don't want to call it ratios. But they met us part of the way, but then they wanted to penalize us if there were any leave of absences. They wanted to penalize us if nurses called out sick. We work in a healthcare profession. We're going to get sick. It's part of our benefit package. Many of us nurses go into work sick because we feel for our colleagues. We don't want them to be short. So the hospital wanted to penalize us when if we called out sick, said that they wouldn't have to do the staffing guidelines or ratios. So we just want pure ratios. And we're willing to work with the hospital, but we need something the hospital will put their teeth into and say, this is enforceable, because right now what we currently have is not enforceable. And they took away our health benefits as well. We are probably 13 hospitals of Barnabas right now, and we lost, and they're a self-insured industry. So they could have said, okay, you know what? We'll make you pay a certain amount for your benefits and all. They took our benefits completely away. As of September 1st, our nurses, with the exclusion of, they did keep those on disability and were going through treatments. But the regular nurses that are out there on the picket line had to either supplement through a COBRA plan, had to supplement through a United Steelworker plan, or went on the open market to do an Obamacare or something like that. So it's just been a lot of, disrespect. And as you said, I think the whole nation is watching, because I think that the way Barnabas feels is if they give it to us, then they have to give it to all of the 13 hospitals in our facility. And we would love to see that. We would love to see it go nationwide. We would love to see that. And our nurses have taken on the fight, and our nurses continue every day to stand out there, whether it's 104 degrees or whether it's pouring rain. I have to give those credit and thank those nurses that come out there every day in solidarity. And it is an honor to work with those nurses who have stood up for this.
Well, Judy, thank you very much. And we're going to come back to you for some more comments. But let's go now to Carol Tansey. Carol is a nurse of 25 years and is a member of the United Steelworkers Local 4200 at the same hospital that Judy works in. Carol, thanks so much for being with us.
Thank you so much for having me. And thank you for being our champion for this cause. To be out here 40 something days and still not have any kind of movement. It is a matter, I've heard you speak on this. It's a matter of dignity for patients and nurses. Do we deserve a fair raise? Of course we do, but that's not the thing we're sticking on. We're sticking on healthcare for our patients. We have a license from the state of New Jersey that obligates us legally to do the right thing by these patients. And part of that is advocacy. There was a nurse prosecuted criminally for the first time in Tennessee this year for making a mistake. If you're overburdened, if you're overworked, the chances you're going to make a mistake are greater. We carry an enormous amount of emotional guilt, trauma, when at the end of our shift, we know we've given everything we have, and you still go home wondering, I could have been there more for a parent. I'm a pediatric nurse, so my patient isn't just the baby in the bed, it's the parents too. It's my responsibility to get them through this hard time. Their child has a terrible diagnosis, to help emotionally support them, give them information, the tools that they need to take care of their child at home. I work in the recovery room. So I have a very short window of time to make sure that these patients go home safe with their parents. If I'm overburdened with more than the appropriate amount of patients, all that gets cut. Safety goes out the window. A child starts climbing out of bed. If they're crying in pain, the system that we have in place just to get a narcotic for a kid, it's just so time consuming, so many steps. We're guardians of human lives. We're not maidens of mercy. We have a huge responsibility, a legal responsibility, and we take that very seriously. And for the hospital to tell us, to make the narrative that it was casual, that we could have avoided this, we couldn't have avoided it. We no longer want to be complicit in not having the right things to take care of our patients. We know it's wrong. We know it can be better. So we are on strike because we no longer want to be complicit with a system that is not providing what we need and what we know is right. It is literally right or wrong. There's no gray here. We need it to be right. And it can't be because they're trying to protect the bottom line of profits. The disparity in salaries is mind-blowing. People who don't have any skin in the game making decisions for people, they have no idea. I'm convinced they have no idea what we do. No idea what we do. They've been invited to come walk a day with our shoes. Judy, our president, makes the joke all the time. Don't take your kid to work, take your administrator to work, just to get an idea of what exactly we go through. The mental stress, the physical stress, the emotional stress, it is a trauma. And as nurses, we are family, we trauma bond. to get through these very difficult situations, you need to have each other. You need to be able to trust each other. And that's why we have. And together we made the decision. We're walking out because what's going on in here is not right. And the only way we're going to get any attention is if we walk out.
All right, Carol, thank you very much.
Thank you.
Our next guest is Nancy Higgins, who is a registered nurse and a critical care expert at Maimonides Medical Center in Brooklyn, New York, where she is also the president of her bargaining unit. She is also the president of the New York State Nurses Association, representing more than 42,000 registered nurses across New York State. Nancy, thanks so much for being with us tonight.
Good evening, Bernie, and thank you for having us tonight. We really appreciate all you've done. My name is Nancy Higgins, and I would like to say hello to my fellow nurses and my militant nurses. My name is Nancy Higgins, and I'm the president of the New York State Nurses Association, and I'm also the president of the National Nurses United, the largest nurses union in the country. I have worked for over 30 years at Maimonides Medical Center in Brooklyn. Over the course of my career, the staffing situation in our hospital has gotten worse, and in recent years, it has become completely unbearable. This is why nearly 7,000 New York nurses went on strike this past January. Just like our siblings at Robert Wood Johnson Hospital in New Jersey, we went on strike because it was the only options we had to fight for safe staffing, for safe patient-nurse ratios, and we won. Nurse staffing ratios save lives. To do my job as a nurse, I need to have enough time with my patients. Research shows that when hospitals provide safe ratios, patient care improves, nurse retention improves. So it's absolutely unacceptable that hospitals' employers refuse to hire more nurses. These ratios are common sense. They should be a standard everywhere. We have seen a mass exodus of nurses leaving because they are fed up with the unsafe patient care and the poor working condition that is caused by management's understaffing. It takes a lot for nurses to decide to strike. So if nurses are going to strike, then you know something is really wrong inside a hospital. Last winter, when 7,000 nurses at Montefiore Medical Center in the Bronx and the Mount Sinai Hospital in Manhattan went on strike to win staffing ratios, the strike came after a year-long legislative battle at the state level. In 2021, we passed a law to establish a process for setting and enforcing staffing standard at every hospitals and nursing home, no matter if the facility is public or private, union or non-union. At the bargaining table, we also fought like hell and won better staffing ratios and enforcement. We went on strike for 3 days in New York City. We had an incredible support, not only from New Yorkers, but from people all over the country and the world. And after 3 days on strike, we won a historic contract that include enforceable nurse-to-patient staffing ratios with expedited arbitrations and potential financial penalties payable to nurses when employers failed to hold up contractual safe staffing standard. It really was a huge win for us. But nurses should not have to go on strike to win basic common sense protection that save patients' life. We are going to fight. We are going to continue to fight for enforceable staffing ratios in every hospital in New York. Thank you. And not only in New York, but we want to fight for every hospital in the country that more nurses, better patient outcome, and better patient care. So thank you.
Well, thank you very much, Nancy. We're going to get back to you in a minute. Our next panelist is Kathy Kennedy. And Kathy has been a registered nurse for over 40 years and is currently a staff nurse in the neonatal intensive care unit at Kaiser Permanente Roseville, California. She is a vice president of the National Nurses United, the largest U.S. union and professional association of registered nurses with nearly 225,000 members. Kathy, thanks so much for being with us tonight.
Well, good evening, and thank you so much, Senator Sanders, for hosting us today. And I'm not going to repeat what you said. My name's Kathy Kennedy, and yes, I've been a nurse longer than any of you guys, 43 years. And, I've been fighting for nurse-to-patient ratios my entire career. This issue that we have needed Congress to pay attention for years, for decades. And to our siblings at Robert Wood Johnson Hospital, we are in absolute solidarity with you. Your strike has been incredible, and we stand with you in your fight for enforceable, safe staffing ratios. None of us should have to strike to win common sense solutions. California is the only state in the nation that has a mandatory minimum nurse-to-patient ratios law, and I was part of that campaign to win it. Before we won our ratios law, I was working in a med-surg unit with abysmal staffing levels. There were many times on the night shift when there were only 2 RNs for 48 patients. That meant each of us were responsible for 24 patients with 2 nursing assistants. It was an impossible task that made me so frustrated that I eventually left and transferred to the adult ICU, where I knew at least we had critical care ratios back then. So nurses across the United States are dealing with this same thing. We couldn't provide the best care for our patients because management deliberately understaffed nurses, leaving too many nurses with too many patients, and our patients suffered because of it. But our union, CNA, fought for and won our ratios law, the first of its kind. We ran an extensive grassroots campaign with tens of thousands of union nurses, held massive rallies, organized thousands of calls, spoke at hearings describing the horrific working conditions, the fact that nurses were leaving the profession because of patient safety and lack of quality care. And we also wrote hundreds of letters to our legislators. The hospital industry was absolutely against us. And guess what? The nurses won. We passed the ratio law in 1999, and then the ratios went into effect in 2004. It was a massive victory for nurses, patients, and our communities. And despite the dire predictions of the healthcare corporations, the hospitals didn't close. Instead, they were able to hire enough nurses to meet the staffing ratios. Why? Because nurses were now willing to come back to the bedside once those ratios were in effect. And California became one of the safest places in the nation to work as a nurse and the safest place to receive hospital care. As a result, nurses from across the country and world still come to California because they want staffing ratios. Nurses want what's best for the patients. We don't just need safe staffing in California. We need them in every unit and every hospital across the United States. And that is why we need Congress to pass the Federal Nurse Staffing Ratio Bill, the Nurse Staffing Standard for Hospital Patient Safety and Quality Care Act. Senator Sanders, we are so very grateful for your co-sponsorship of this bill, and we urge every senator to join you in supporting it. In California, we won ratios with strong union advocacy and grassroots campaign. We can do this nationally, don't you think?
I do.
Thank you.
Kathy, thank you very much. What I want to do now is go back to New Jersey, go back to Judy. And Judy, in your remarks, you mentioned travelers. Now, not everybody knows what a traveling nurse is. Explain what the hospital is doing in terms of replacing you right now and how much money it costs to bring these traveling nurses in. You want to say a few words on that?
Sure. the travel nurses were brought in. Some of us applied. I applied to the United Strike Nurses Association when we first started, and I had conversations with them. They were paying $120 an hour. They were guaranteeing, if I took the job, crossing my own picket line. So I just wanted information. So I became an applicant. $120 an hour. They were giving me 60 hours a week, which anything over 40 hours would be at time and a half. The second week I would get 48 hours, and which was bringing, I think we figured it out to like $7,500 a week. They were giving them housing. They were giving them food, and they were giving them transportation to and from the hospital. And also some of them showed us a $500 gift card that they were given. And one of us said, oh, here at the end when they were leaving their strike, and I don't think there was anything on it. You had to do whatever. But they've given them so much as far as what's going on in the hospital. They were asking for a 1-to-5 nurse to patient ratio on a med-surg floor. I can tell you, I have seen pictures of floors. Those nurses in the hospital now, I will call them scab nurses. I will call them travelers. I will call them whatever they are. They're not supporting the nurses. They are scabs. They're dishonoring the entire nursing profession. It's not only my hospital, it's every nurse in this country that they are disrespecting. And the amount of money they're getting is ridiculous. They're signing them on from 2 weeks to 13 weeks. Some of them, what I've heard from the inside is that they're getting 3 patients. We're only asking for 5. We're not asking for 3. They are giving them more and more and more than we have ever asked for.
So Judy, let me ask you this question. If they don't have enough money, if the hospital doesn't have enough money to have the kind of patient nurse ratios that you want, how do they have all of this money for traveling nurses?
I think a lot of people digging into the finances of Robert Wood Johnson, they're pretty rich. If you look at the CEO, Barry Ostrowski, he made $17 million.
Let's stop 1 second. Say that again, let everybody know. You're struggling to get decent patient nurse ratios to protect your patients. How much did the former CEO want us to make?
$17 million in 1 year. $17 million. I think we calculated that, and it came out, I want to say $100,000 an hour or something like that. Something ridiculous. I believe the Barnabas system has some of the richest, highest paid executives on the boards. The amount when we have uncovered, thanks a lot to Nancy and some of the people she's put me in contact with, $6.6 billion in offshore accounts. They are loaded with money. And to say that they are not going to give to the workers that work every day to build that hospital, the comprehensive cancer center, the stroke center, the level 1 trauma center, it is just ridiculous the amount of salaries they are getting. And to penalize the workers, and like I said, even to the probationary employees, I'll tell you something, Bernie, employees that were there 90 days, they were on probation. On day 90, when they no longer had use for them, brand new nurses, they sent them out to the picket line. They said, go join your union workers on the picket line. They hadn't joined the union yet. They were brand new. You're losing. They sent 40 people out. I believe 8 to 10 of them have resigned from the hospital. What are we doing to these nurses? What kind of respect are we showing these new nurses that this is a quote unquote family? They sent them out to the streets. We can collect unemployment thanks to the state of New Jersey's unemployment laws. They probably cannot because they were students and then they went into a nursing profession. So what they did to them as well, I believe, was a disgrace.
Let me ask Carol a question. Carol, I think you and others talked about a very serious crisis we have in healthcare, and that is nurses are leaving the profession right and left. They are getting burned out. They're disrespected. You very emotionally, I think, made the point you were trained. You want to do your job. You're proud of the work you do. And it breaks your heart that you don't have the capability of doing what you are supposed to be doing. Talk a little bit about burnout, disrespect, and what that means for the crisis we're facing in nursing today.
So there's many components that go into building a nurse that's going to stay at an institution. Respect and dignity go a long way, but we're not seeing that. Any chance the hospital has, they're not utilizing the opportunities to capitalize on this movement. They should be using this opportunity to say, let's be the first hospital in New Jersey that recognizes this. Use that as a marketing strategy. But instead, corporate greed is in full effect here. Their only goal is to stamp out our union so that we will not have any protections and to move on. When you're trying to recruit caring people, ethical, loyal people to this profession, and that is the welcoming message, that's horrible. They keep their narrative in the news is they're the highest paid nurses in New Jersey, the highest paid nurses in New Jersey. We don't even get a cost of living raise. That's never factored in there. So to say that we're the highest paid nurses is unfair and untrue. And to say that, to just keep drawing the attention to that, that does something to your moral character, because that's not why we're there. Do we deserve a raise? Yes, we do. But we're literally there trying to take care of people. When a nurse comes out of nursing school, that's college. They need people to raise them. In a serious situation, someone stops breathing, someone's heart stops. You don't learn that in a book. How you get these young people through these very difficult situations is your mentors, your other nurses who have the experience, who unfortunately have seen people stop breathing, their hearts stop before, and you work with them so that they feel comfortable for when it's their turn to be the one that's in charge of that. We're not finding the ability to do that, to mentor nurses properly. We're in charge, we have too many patients ourselves, we're orienting somebody. That's a lot of responsibilities for one person. And when you have that many very serious responsibilities, something is going to get lost. It's a very frantic feeling. You never want to feel chaotic when you're trying to take care of people. You want to feel like you're in control, and only I can decide that. My director cannot tell me how many patients I should be having. I'm not a slacker. If it's not comfortable or safe for me or not beneficial for me, I resent having to be forced to take more patients, because I know it's not right. And it is up to me, because if something goes wrong, it's all on me. There's nobody supporting me. I'm legally obligated to make that decision legally.
Thanks, Carol. All right, let me get to Nancy and Kathy. You guys very bravely, the union stood up and you won safe patient ratios. What has that victory meant to morale among your colleagues, retention among your colleagues, and patient safety in general? Okay.
Thank you for the question, Bernie. And as I stated earlier, more nurses, better patient care. When we come out, we say that we need help. We need to care for our patients. If I walk into a unit, I work in the intensive care unit where our patient ratios should be 1-to-1 or 1-to-2. When I end up with 3 patients, I am not able to deliver the quality care that the patients need. I am not able to take a break and have a cup of coffee. How do you expect somebody to go into work from 7 a.m. and at 3 p.m., 3 o'clock, 4 o'clock in the afternoon, you have not even taken a break to have a cup of coffee? And we not able to deliver safe patient care to our patients. So when we took the stand, we said, you know what? We need for the hospitals to put patients before profit, because those hospitals administrators, the CEOs, not only they making a lot of money, when they are sick and their family members are coming in, they demand that their family members have a 1-to-1 patient ratio. So therefore, they know what it's like to have safe patient nurse ratios. They just don't want to do it because, again, they are looking into profit over patients. So it means a lot to us as nurses, as caregiver, to stand up. I call them the bullies, to stand up to them and say, you know what? It's time to care for our patients. During the height of the pandemic, we knew who suffered. It was the black and the brown communities, the places where we didn't have enough staff. We didn't have enough nurse to patients. And we saw what happened at the height of the pandemic. We lost a lot of patients. We even lost a lot of our members or nurses that work in a poor working condition. So it means the world to us that we are going to continue to fight. We are going to continue to push just because we have the language, we have the contractual language that we need to have safe patient-nurse ratio. We could go to expedited arbitration, but the work does not stop there. It's a continuous struggle. Every day we have to fight, and we will continue the fight in order to deliver safe patient care to our patients. That's what we're going to continue to do.
Nancy, thanks very much. Kathy, do you want to say a word?
Yeah, I do.
On how morale has changed, perhaps?
Yeah. Well, we've had our ratios now for close to 20 years. And let me tell you, it was night and day, so in my talk, I talked about back in the 80s when I took care of 24 patients. Those days are long gone because of the racial law that we have in place today. And, a lot of it has to do with, our duty as nurses to be patient advocates. And so, when you talk about burnout, it's not burnout. This is about moral distress. When you see states that don't have the nurse to patient ratios, it is as my sibling colleague, can't remember your name, I'm sorry, Judy, said, it is really about, the importance of being able to care for an appropriate number of patients to provide that education and that care. And so when you're left at the end of the day where you just feel like nobody is listening to you, it's a moral distress. It is something that we take home with us. Nurses cry in their cars because they know that at the end of the day, they weren't able to provide the care that they know that they could have if we had nurse to patient ratios in place in some of the other states. So for Californians, when we did get the ratios, the nurses that left when we didn't, they hung on to their license. They just chose not to work in acute care hospitals. But as soon as we got the ratios in place, they came back. They really came back. So this shortage of nurses is really made by the hospital industry because they're putting profits over patients. And so this is, for us in California, it was a fight, but it was a fight worth having. And we are really pushing to see nationally nurse to patient ratios across this country because it works and it saves lives.
Talk a little bit, somebody jump in. One might think that the CEOs of hospitals would want the best quality care for their patients. One might think that the CEOs would like to have have their nurses excited and with high morale about the work they do every single day. So what, in your judgment, anybody can jump in here, what world are the CEOs living in where they are willing to bring in traveling nurses at huge expenses, an industry which pays CEOs outrageously high salaries, but fights like hell to prevent nurses from having good patient ratios? What's going on there among the administrators of hospitals? Anyone want to jump in on that one?
I wouldn't mind.
Please.
I have to say, I had no idea. I had an inkling of what was going on behind the scenes, but not until we came into this strike did I fully understand what was going on. After our negotiation, the amount of gaslighting that went on about what we expected, what we've been asking for, this is not a new fight. I've been a nurse 25 years. The fight's been going on for 25 years. It's just progressively getting worse. taking advantage of caring people by putting more and more and more responsibility on them. It's for the patients. It's for the patients. We bought it for a long time. And it's also been frowned upon to actually tell our truth, to tell our story, that to not make the public fear that things aren't going to be safe. But it's not in an effort to alarm people. It's in an effort to bring it to the front so that it can be confronted. There's no reason the hospitals are the boss, the administrators that are making all the rules. Money is evil in this scenario. Business people should not be making these decisions based on money when people are the collateral damage. To be out here 40-something days, I don't even know a word strong enough. It's disgusting. It's disgusting that they're trying to make an example of us, quiet us, embarrass us, humiliate us, demoralize us. We're literally fighting for our lives, our patients' lives, our communities. The narrative that they're making these decisions just literally based on money. They just don't want to have to shell out more money down the line. They're trying to keep their margin down. I used to be afraid to talk about stuff like that. I'm not afraid anymore. I'm really not.
Right.
I don't care.
That's
I am
right.
not going
That's
to
right.
face this with fear anymore. If this is the reason I get terminated from this place, I will find a future someplace else. But I refuse to be complicit with this anymore. I know it's not right, and I'm not going to stand for it anymore.
And I could jump in to tell you what it's all about. It's all about with the CEOs, like I said, making profit. If they could use you and abuse you and bring the same amount of money, when you go in, you're working short, they still charge the patient the same with their insurance. You don't take a break. And it's also anti-union. What's going on here is we call it union busting. There is no reason that you should be on strike for 41 days. And at the end of the day, your CEO is making $17 million a year. And your same person is saying that, well, we cannot afford to give you a raise, but they're spending millions of dollars a day on replacing you. It's about not caring for human life. It's about the CEO, failing us. It's also the government. No one cares. They are failing us. Someone needs to step in and provide, like you're doing tonight, Bernie, safe patient-nurse ratio. It should be across the country, all over the country. It's about how they are taking advantage of us as workers, because at the end of the day, as a nurse, how many of us will go in and we have to finish the work? If we're supposed to leave at 7 o'clock, we'll leave at 10 o'clock in the evening. I've had babysitters quit when they used to watch my children because I will never get home on time. We will get the work done. We would never leave our patients, not finish documenting, not giving them medication. We sit back in the lounge and have conversation with the family members. We help them, we sit there, and then we forget ourselves. We always put the patients before us. And these people, they know, because they are the same people when they're coming in for care, they ask for you to be that one-to-one for them. So they know our value, but they are also, there is a movement, anti-union. The only way it's called union busting, because they are bringing all these people in. Right now, you're outside without a paycheck, without medical coverage. They refuse to give you safe patient-nurse ratio. However, now you're asking for 1 to 5. These nurses are having 1 to 3. So it's not even about money. It's about stopping us from organizing. And we will continue this fight. We'll continue to organize. We'll continue to fight for our patients, to fight for our communities, and to fight for our profession. And we will continue to make sure we deliver safe patient care, safe ratios all over the country, not just in New York, not just in New Jersey.
Nancy, thanks. Well, let me just say to Judy and Carol, I am the chairman of the Senate Committee on Health, Education, Labor, and Pensions. So you got two issues here that involve that committee, that's health and labor. Please convey to the CEO of Barnabas that if they are not prepared to sit down and negotiate in a serious way with the union, that we'll be holding a hearing in New Brunswick, and we look forward to hearing the testimony from your CEO as to why he thinks he can make whatever the hell they make, 17 million a year, and not have decent patient safety ratios in the hospital. So convey that message, will you please?
Will do. I will do that tomorrow, I promise. Thank you so much. Thank you.
All right, well, let me end the way I began. What you're looking at, folks, are real heroines. These are people who put their lives, certainly during COVID, they did put their lives on the line, and some of them died. And as you've heard from them, they put their patients first. They lose babysitters because they don't get home when they should. You're also sitting talking to grieving families or patients and so forth. We have a healthcare system clearly that is in deep trouble. But to the degree that it is functioning at all, it's because of these folks, because of the nurses. So I just want to thank the nurses who are with us tonight, nurses all over this country, for the incredible work they do. And I want you all to know that at least some of us, I can't speak for everybody, but some of us in Congress understand what you're going through. And we're going to fight to make sure that there are safe patient-nurse ratios throughout this country, and that we're going to have a healthcare system that's function is to provide quality care for all, not to just make money for the people on top. So let me thank all of you with us tonight, and the viewers, thank you very much for joining us. We'll see you soon. Good night.